It is time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, and featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning.
Well, we want to talk to you a little bit about, first, some of those bath toys. I've got kids, and we've got bath toys. I mean, I just want to know, are they clean?
Yeah, it's interesting. Some studies have just come out, and rubber ducks and other similar bath toys are probably pretty clean, but that's what a lot of people think. Actually, the opposite is true. Unfortunately, spending all that time in warm, dirty bath water is like a buffet for bacteria. The bacteria can cover and fill these ducks and other bath toys, as confirmed in a new study.
Doctor, what is a person to do about that? Do you just get rid of the ducks or not take baths or what?
Yeah, those are both a little extreme, but there are some suggestions about how to avoid getting infections. Basically, they center on the idea of regularly cleaning these toys. One option is to soak them each month for an hour in a bucket of warm water with half of a cup of white vinegar per gallon of water, and then rub the toys gently with a sponge and air dry them. Or put the toys in the dishwasher once a week, or boil the toys periodically. All of those are viable options to clean the toys.
Doctor, I've heard about using the dishwasher. I've heard about using the bucket of warm water as well. I think it's the drying part that I haven't heard too much about. And also the little holes are at the bottom of those rubber duckies that keep them full of air. Those don't seem like the most clean place in the world either.
No, unfortunately, the hole is where all the fun comes from as far as the squeaky noise, but it's also a passageway to the inside, and it's a veritable petri dish in there. Although the duck may not be as much fun without the hole, it's better to close that off. So that can either be sealed with super glue, or they also sell toys without a hole.
Dr. Bramwell, moving to the human body, have scientists discovered actually a new organ?
Well, it certainly seems that way. There's a definition of an organ is a part of your body that has a particular purpose or function, like the heart, lungs, liver, and skin. There's also a widespread network of dense connective tissues and fluid-filled compartments within our bodies and between tissues called the interstitium. And this may function like an independent organ, which would be one of the largest in the human body, according to a new report.
Okay, it's called the interstitium, and what in the world is it? What does it do?
Well, again, I think of the interstitium as the space between. One function of the interstitium may be in fighting disease. The fluid in the interstitium plays a role in sending white blood cells, which are the body's infection fighters, to wherever they're needed. So the interstitium may play a role in cancer metastasis as well as edema and fibrosis.
Now, why is this discovery important?
Well, it turns out that if we can understand this new possible organ better, this may help us in diagnosing and tracking cancer and other diseases that may use this area as a way of spreading. Focusing on the immune capability of the interstitium could be a key to finding new effective treatments for cancer and other diseases.
Well, Dr. Bramwell, we thank you, as always, for your time this morning on KBOI.
Thank you very much.
You too. It's the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho.